I'm Dr. Barry Goodfield, Director of the Goodfield Institute and the developer of the Goodfield Method for the treatment of extreme trauma. I've been asked to provide insight into the origins of the Goodfield Method. It began nearly 35 years ago as part of my early work in dealing with Holocaust survivors in Europe. People suffering extreme trauma, reliving unimaginable horrors. Not just shut down, walled off, cocooned within themselves. How do you get traumatized souls like that to speak the unspeakable, to express the inexpressible? The fact is that in many cases you can't. As a therapist, I felt impotent, powerless sometimes, fighting to help my patients let go of their pain and watching them desperately on some levels to hang on and to hold it inside. I wanted to help, and I did. But there are limits to helping when there's no way to isolate the pain. That's always been the dilemma with extreme trauma, and it's always been the basis for my life's work. As my career progressed, I became increasingly involved in psychological profiling, not just the garden variety, the deep, dark, intimate profiling of monsters, the monsters that appeared before the International Criminal Tribunal in The Hague. Hardened savages, experts at lying to themselves and lying to others, and concealing every trace of human emotion. I discovered that the only way to gain insight into these people was through the window of their face. The involuntary eye blinking, the nose twitching, the momentary curling of the corners of their mouth, the pulsing of the facial muscles, which I call the non-verbal leak. Because such leaks are generated unconsciously, they cannot be prevented, controlled, or manipulated in any way. They are what they are, the truth. Pure, spontaneous, intimate, and ultimately revealing. What Sigmund Freud asserted more than 100 years ago, that the unconscious can be seen, had finally become a proven reality. For the last 25 years, I've dedicated the expertise of the Goodfield Institute to the refinement of the nonverbal leak as an advanced technique for the treatment of extreme trauma. If only I had the current knowledge when I was dealing with the Holocaust survivors 35 years ago, what took me 2 years could have been done in 2 months. Today, the Goodfield Method is in use for extreme trauma relief in 20 countries on 5 continents. Our PTSD veterans need to be next.